Lisa Buckley. I'm an assistant research scientist at the University of Michigan Transportation Research Institute. I'm here as the Training Education Corps representative. I want to thank everyone for attending, including those that are attending remotely. Give you a special welcome, and if you have any questions during the event, type them into the chat box and we'll do our best to address them. So for those of you who don't know us, the centre is a CDC-funded university supported research centre focused on injury prevention. We provide training and educational opportunities like this one, plus courses in injury, internships and fellowships. And we've recently worked with the School of Public Health to develop a certificate course in injury. We fund research with an annual pilot study competition, and we support practitioners and policymakers by providing information to help support injury prevention efforts. So if you have any questions about the centre, please come and ask me at the end. I want to let you know about the next lunchtime seminar, which is Thursday, November 5th, where Michelle Macy from Paediatric Emergency Medicine will talk on child car seat safety. She has some interesting research there, so please come along the first Thursday of November too. We're also hosting a full-day summit on opioid overdose here in town on Tuesday, December 1st. We'll feature national speakers, networking opportunities, and a poster session. So if you're interested, please go to the website, the Injury Centre website, to register. Registration is filling up fast, and it's free, which is fantastic. And we'll also offer a webcast option for those unable to attend in person. And if you want any more information about the centre or our events, injurycentre.umich.edu is the website. It's a great source of resources. So if you haven't already done so, there's food in the back, but it looks like most people have got to that part. We're very pleased today to welcome our 3 interns who are going to talk today about their summer experiences, which sound quite amazing. And welcome. It's an impressive group. First of all, we'll have Dwana Bass, a nursing student at Wayne State who worked at the Michigan Department of Health and Human Services under the guidance of Laura Rowan, who's tuned in remotely. Hello. We also have Courtney Coleman, an MPH student at the School of Public Health here, who was lucky enough to go to the CDC National Centre for Injury Prevention and Control under the direction of Dr. Armistead. And we'll also hopefully hear about Alana Kivowitz's presentation experience this summer from her mentor, Jen Martin. So before we do begin, I'd like to thank very much the mentors. This program doesn't work without the mentors, so thank you very much to those. And let's begin with Dwana. Right to your presentation. Great, thank you. Thank you.
Okay. Hello, everyone. My name is Dwana Bass. She kind of introduced me a little bit, but I'm going to start off by talking a little bit about my background. So I've been a nurse since 2005. I spent maybe a year and a half in an internal medicine unit and 8 years in a medical intensive care unit at a trauma center. I'm currently a Wayne State graduate student. I will be receiving my master's in nursing and receiving actually an advanced practice public health nurse degree. And that will be in December of 2015, thank God. And my current position at Henry Ford Hospital is as an injury prevention coordinator, and education and outreach is also part of my job. By us being a trauma center, we must provide those different types of services. So everything from maybe falls for elderly, violence, and any other injury that you could think of is my job to kind of educate and provide different services for our patients. So first, I would like to say thank you to the Injury Center for selecting me. I guess I am kind of a weird student here. I am from another university. So I really appreciate being selected. So thank you for that. And they did a very good job with actually placing me. They put me at the Michigan Department of Health and Human Services in Lansing. So part of my summer was spent driving. I went to Lansing back and forth, kind of did my job as well, but it was the best experience I could have even asked for. I worked with the Injury and Violence Prevention section, which is kind of divided into three different parts. There's injury and violence, and there's injury prevention, which is Laura Rowan. She's on the phone. She was my supervisor there. She's the injury prevention consultant and also the Michigan Safe Kids program coordinator. There's also a violence prevention section, which also includes suicide, and that part is led by Patricia Smith, and she's the violence program coordinator. And they also have intimate partner violence, which is led by Jessica, and she handles the rape prevention and education. So as you can see, these are just a few pictures of where they had me. I was very excited when I got there. I felt at home, like I was at home, like I was a part of MDHHS. I had my own cubicle with my name. I had my badge. It was confiscated when my tour ended, but I took a picture of it because it was a very cute picture. So this is where I spent most of my time. Unlike my job now, I have an office with two other office mates. I was in a cubicle, so that was different for me. So they also had everything planned out for me. I had projects and responsibilities, which was kind of listed on a packet of information that was ready. Part of my responsibilities were going to be evaluation, which is with unintentional injury. So that involved the Michigan Sports Concussion Law, which was put into place here in Michigan in 2013, June of 2013. Is everyone familiar with the Michigan Sports Concussion Law? Just about. So it protects our youth athletes, and there's a process that must take place when an athlete is injured during organized sports. So what Laura decided to do, which was my supervisor, was to kind of send out a survey to see how well, not necessarily to, not to check and see if people are following it, but just seeing how well it's working and if it actually is protecting our youth. So I developed a survey, which was I developed a survey that was our target population. I'm sorry, I'm getting tongue tied. But I developed a survey that was for teachers, coaches, but not necessarily coaches, any adult that was involved in organized sport with children, and providers. So we did the survey, put it together, and wanted to really ask questions about, how well it was being facilitated in the schools, if everyone was aware of what should be done, and especially with the teachers, because I think a lot of the information with the teachers is kind of displaced, not really taking place. So we kind of wanted to hone in on those types of things. So I put the evaluation together, the survey, but unfortunately wasn't able to send it out and receive the information because there's a process that must take place in order for it to go any further. So that was exciting. That me an opportunity to use what I learned in school, which I hadn't used before, and kind of taught me how to think a little bit more in depth on how you want questions answered or how to ask questions. So that was a good opportunity. I'm going to skip epidemiology for a minute and go to social media. The social media portion went around injury and violence. So I combed the internet and looked for all types of ways people can injure themselves. And I created a calendar for a whole year. And each type of injury, each observance day, I kind of made a spreadsheet so that the department will be able to send out a social media message for each type of observance. So I did it with Facebook and Twitter, and I used data from the Michigan website or either the US website or from Whiskers or whatever to kind of make that message specific to that population and give some data to let people let them know how serious of a problem whatever injury is, and to give them some information on how they can prevent injury or if they wanted to. So it's kind of that was kind of cool and interesting, and it was really a big task. So the epidemiology part is with intentional injury. This project was actually with Patricia Smith, and I am working on a profile to kind of identify the working age adult in Michigan who died by suicide. From my understanding, what Patricia told me is that it is increasing in numbers, and there's not really a lot of prevention for that group. So I am actually still working on this project and plan to continue till the end and hopes of being published. So that was a great opportunity. So the most interesting part is seeing the internet come to life. And when I say that, it's because I've been in my position in injury prevention for a year, and I've looked for resources. I've been on the U of M Injury Center site. I've been on Michigan website. I've become part of all types of groups. And you see people's names and emails and things. And to go to the state of Michigan and see Robin, and to come here and see Tina, and different people that I have been seeing online, all the pretty exciting. And I think I'll remember them and they'll remember me as well. And learning about the Michigan Violent Death Reporting System, it was interesting. I had maybe a couple of hours with Abby. She's one of the data people for the MVDRS. And she just went through all of the different data points that they collect for each violent death. And it was very interesting. And I would have never known that everyone's report had a place in that system. So it's important for the doctors, the coroners, the law enforcement, everyone had their section in that database. So that was very interesting. And now I am scrolling down Facebook and I'm seeing messages that I researched and put in place for MDHHS. So that's pretty cool. So what did I learn? That injury is a public health concern, no doubt. There are unlimited ways in which people can injure themselves. Me trying to fill the calendar and get all of the information off the website was over. It's like when I thought I was done, I would find another observance day. So there's so many ways in which we can injure ourselves, and it kind of helped me decide what I'm really interested in as well. And of course, I have a strong interest in injury prevention, and I plan to pursue other opportunities. And of course, that I get a lot of work done in the go, but that was a selfie that I took. So my future plans, of course, I graduate in fall of 2015. I am going to continue to try and expand my role. I think that public health is really becoming an important factor in healthcare and in our health system that I work for, and there's not many opportunities for public health people as myself to kind of integrate different preventative measures or use what we've learned to kind of treat our population or provide primary care for our population. So I have a couple ideas on how to expand my role and make it as where I'm providing injury prevention for our whole system. And I do also plan to return to school fall 2016. I've decided to pursue a PhD. So maybe you guys will see me again for some reason. And that is all. Thank you. Laura's on the phone. I'm not sure if she wants to say a few things as well.
Sure. Thanks so much for the opportunity. Can you hear me okay?
Yes. Oh, sorry.
Okay. One of the things that a couple of things that I want to include about the intern experience. We were so grateful for Dwana's time and also for the Injury Center's program. I'm fairly new with the department. I guess I'm still cautiously kind of playing that card, but Dwana was the first intern that I worked with since I've been here, and it was just such a great experience. And I was nervous a little bit just on some of the challenges that she was going to have to deal with, and this isn't something that I mentioned to any yet, but she started at the beginning of May with us, and I was gone virtually for the month of May. And so we tried really hard to put some detailed notes together to help her get started so she would know what to do when she started here. And she simply jumped in with both feet, and she was well underway in her efforts and with the projects that we laid out for her when I got into the office. I mean, she's just tremendous. And the other thing that I really appreciated about her, and this wasn't a requirement, we to a stipulation. It was just very lucky on our part because I think we benefited from Dwana's clinical background. I mean, she added perspective to the program and to her efforts on her assignments that I simply don't have. I don't have a clinical background myself, and so that was just so helpful and so insightful. But it was a great experience, and Dwana, you set the bar really high here. So I just really appreciate the time you were able to spend with us. It was great work.
Thank you, Laura.
I think we've got time for one question, then we'll move on to Alana. Vivian.
All right, so hello everyone. I'm Courtney Coleman. I'm a second year public health graduate student here studying health behavior, health education, and I'm going to talk to you about the internship that I had this summer. So the who, what, when, where. I was working at the CDC in Atlanta, Georgia this summer. I was working on a project called Delta Focus, which is a cooperative agreement between the CDC and 10 states. All 10 grantees in Delta Focus work to eliminate intimate partner violence through primary prevention. So I had two major projects that I was working on this summer. The first one, the main one, was doing an evaluation of Delta Focus thus far. They're about halfway in between their grants, so I was doing this up until what they have done now. So what I was doing was each state provided information on the progress that they had been making and the way they design their coalitions, and so that's what I was evaluating. Included in the final brief, I had in the final brief, I had observations about the network sizes and structures and the analysis and recommendations. The goal of this project was just to basically have an evaluation on how coalitions are structured in order to give future grantees ideas on how to use Delta Focus funding to eliminate intimate partner violence. And then the second project I was working on was to do a data dashboard, which this picture is kind of like a little snippet for those who are unfamiliar with a data dashboard. We were using the software Tableau. So basically, I was just trying to get the groundwork going for that project. And the goal of this project was just to create a dashboard to help share information on Delta Focus across the departments within the Injury Prevention Center at the CDC. So what I did was I was collecting data. I was getting people access to the software on like government computers and things like that. So by the end of the summer, I had 10 state briefs, one for each grantee, and then one comprehensive brief about Delta Focus, which included all 10 states, and then, like I said, the groundwork for the data dashboard. The state briefs were shared with the Delta Focus team along with the final evaluation brief. So I also presented those findings to them. The most interesting part to me was just the CDC in general. I really was very unfamiliar with the CDC. I didn't know much about it. I didn't know how large it was. I didn't know what kind of scope it covered. Like, it was just so, I was just so surprised at how big it was, how it functions, how it's organized, and just everything that was the CDC. What I learned a lot of practical skills about evaluation. I had no evaluation experience prior to my internship. So just learning analysis, doing coding, just creating state briefs, things like that. The take-home message that I got was to think more big picture. A lot of times I would get kind of honed in on the details, on little things, and I was reminded and I have to continue to remind myself to think big picture, and so that's what I'm doing now, in the classes and the work that I'm doing now. Future plans, my short-term plans is I'm actually taking an injury prevention class now and an evaluation class. So that's helping me learn a little bit more in detail about those two things. And in the long term, I am interested in a career and program evaluation. So that's something that I would be interested in continuing. So yeah, that's kind of basically all that I have. Any questions, or Teresa's on the line too, if you have anything to add.
Hi, everyone. Can you hear me? This is Teresa. I'm at CDC.
Teresa? Hi, Teresa.
Hi. So Courtney was amazing, and she's so incredibly modest because she did a lot of work. And just to give an example of the kinds and the quality of work that she did and how willing she was to figure things out, with the state-specific briefs that she developed for the partnership analysis, I was like, this would look really good if we could do this with like radial graphs and create so we can show the size of the networks and the different connections in the networks. And it would be really great if we could do this, but I don't know if it's possible. And so Courtney went, did the research, figured out how to do it, watched YouTube videos, and brought the data back to me and said, "Is this what you mean?" And that was just like a perfect example of just how incredibly self-directed she was and so helpful. And similar to the previous mentor, I was gone when Courtney arrived as well, so I had laid out all of these things that had to happen before I got back. As she mentioned, CDC is huge and has lots of procedural steps you have to take to bring anybody onto the campus and into our network, and so there are lots of glitches, but Courtney always was very patient with us, so I really appreciated that. Probably the size of CDC, she was discussing a little bit of that kind of factored in. But yeah, Courtney was so incredibly great to work with and bright, and it was just a very good experience, and she did so much work. And the last thing I will say is, even to develop those briefs, Courtney also interviewed staff about their experiences and perceptions of the work and what the partners and what the grantees were doing. So she actually learned a lot of skills and did lots of things that I don't think always comes across when she describes the work. So she did an amazing job, and we were so incredibly glad to have her.
Thank you.
Any other questions?
So I'll just add with Teresa on the phone, just to thank you. It's always logistically a little bit difficult to figure out over the years how to match up our interns with folks down at the CDC, and thank you to Tina also and to making that be able to happen. And it sounds like it was a smooth experience for you, and we look forward to having those continued opportunities for our interns on campus there. So thank you.
I have a question. What did you learn about the program you were evaluating? What were the take-home messages?
For Delta Focus, it's what I learned is that even though you have to think big picture, every state is very different in a lot of ways. I realized that the way that the federal government is working with states, is working with the local government, they really are doing a great job with that. So looking at each state and what they have in terms of like demographics, their geography, their goals, and stuff like that, I learned that there's a lot of different ways you can go about doing primary prevention for intimate partner violence, and a lot of the states had they had great coalitions and great strategies that they were using.
What advice would you have for the next person on the way?
My advice, I actually have this on my poster for the poster session tomorrow. It's definitely start early. A lot of things can move kind of slowly at the CDC, and then to just be patient, because you're not going to necessarily come in the first day of work, like have a bunch of stuff to do. So just be patient and just stay focused.
Can I ask a question? Do you do dashboarding? Tableau or?
I didn't actually build the actual dashboard. I was doing more of the preliminary work, so it was just getting access to Tableau on computers and things like that.
Okay. Does the School of Public Health do much dashboarding in communities, or I wasn't sure?
notes. I think that data visualization is something that's increasingly popular in public health. So what are the different ways we can more quickly convey information and have people easily navigate it? And so Courtney wasn't here, her internship ended, but over the last 3 days, we just had all the Delta Focus grantees here at CDC in Atlanta, and I actually demoed and they used the dashboard, Courtney. So you would have really enjoyed that. And so the thing that you can't see with that image is that it's a very interactive modem for like conveying information. So anyone who has access to it would be able to click on a state and learn more about what's happening in that state for primary prevention, for grantees responded with Delta Focus, click on a specific topic or category of prevention and learn which states across the states, which ones are doing work in that category, and then actually click on the strategies and learn more about the strategies. So those dashboards and data visualizations and ways to more quickly convey a lot of information that people can kind of digest more easily with, I think it's growing. It's like, how do we tell those messages and the impact of our work, more easily and in ways that people can navigate and gravitate towards. So, and Courtney did more than coordinating. Courtney also pulled all the information out of our prevention strategy database that the programmer needed to develop that dashboard. So what you saw in that like flat shot, he used the data that Courtney provided in order to do that.
Well, thanks, Courtney. Unfortunately, Alana can't make it, but Jen, her mentor, has very kindly agreed to sit in and talk about the experience.
I'll do my best to capture Alana's fabulous enthusiasm for this. And I apologize, I'm gonna have to look at her slides a little bit as I'm talking about it.
Jen, do you want to introduce yourself too?
Sure, so I'm Jen Martin. I'm the Director of Government Relations here at the School of Public Health. And I spent part of my time working on the Injury Center. I've been here for, 13 and a half years, and before that I was in Washington, D.C. for many years. So my expertise is in advocacy. It's pretty narrow. Can apply it to a lot of different things. So when I was paired with Alana, I'm a lawyer by training, and I was paired with Alana, and at first I was like, oh, she's in the School of Social Work, and her expertise is really clinical in an individual patient setting. She had worked as a crisis counselor for Lifeline, and also has been very active in SAPAC here on campus, a Sexual Assault Prevention Awareness Center. So I was a little unsure how it was going to go, but after I met her, I don't know how many of you met her, but we connected immediately and figured out immediately that we would find some opportunities to work together. So sure enough, oh, this is very sweet of her. Do I need to get rid of that little box, or is that okay? Okay. So, so as it turns out, she started working with me in early May, and her passion with the Injury Center was intentional injury. So she had experience as a crisis counselor working with victims of domestic violence, suicide prevention, and my experience with the Injury Center had always been on the unintentional side, so distracted driving, the repeal of the helmet law, which makes me crazy, things like that that really fell into a different category. So again, I was thinking, wow, but I learned so much from her. So we met on a Monday, her first day, to sort of go over a work plan. And literally the next day, I was in Lansing, sort of in my volunteer capacity. I do a lot of advocacy for the animal welfare community because I'm a huge dog lover. So I was in Lansing, and I was at a lunch meeting with the animal law section of the Michigan Bar, and they were discussing some legislation that had just been introduced as part of a domestic violence package that would allow personal protection orders to include pets. Because come to find out, news to me, the link between domestic violence and animal abuse is very strong. And so I'm driving back from Lansing and I'm thinking about Alana, And so I called her and we talked about this, and she had had personal experience working with victims of domestic abuse who had stayed in dangerous settings because of their pet. And so I said, do you want to testify in like 2 weeks? And she said, sure. So we put together, testimony. It was really all her. I have to say she was amazing. But part of that process of thinking about how an experience in the clinical setting can inform the broader macro policy was new for her. And this is what I do here at the school, is I really try to train people to engage policymaking and decision making. So we spent some time going through each member of the committee, thinking about what they were interested in. People like Todd Corser were on this committee. I don't know if you guys have followed this, but he recently was expelled. Actually, he resigned. He got out before for bad. So because this piece of legislation was part of 6 bills, a package around domestic violence abuse, sure enough, one of the bills dealt with issues of custody with children of domestic abuse situations, and the right to life people showed up. And it was such an insight from someone from San Francisco. Alana's from San Francisco, maybe even more of a bubble than Ann Arbor. So she really got the flavor of the karma and the political situation in Lansing, because the hearing was sort of taken over by this horrible video that was shown, and many other agendas. But long and short of it is that she prepared outstanding testimony, which I'm going to pass around to you. And then she was actually picked up by the media. I will read the quote. According to Alana Kivowitz, a crisis counselor at Lifeline, about 85% of women surveyed at domestic violence shelters reported incidents of animal abuse by their abuser, but only 3% of shelters currently accept animals alongside survivors. This is a problem that I was not personally aware of, the depth of this, but it certainly came to light that day. So while we were in Lansing on May 19th, we learned that there's a federal counterpart to this bill, which took us to Washington the next month. So sure enough, legislation was introduced by Catherine Clark of Massachusetts, because she had been in the state legislature in Massachusetts and dealt with this at the state level, decided there needed to be strengthening of the federal component. So she introduced legislation in the House, bipartisan, with Ileana Ros-Lehtinen from Florida. And then while we were in DC, our very own Senator Gary Peters joined with New Hampshire Senator Kelly Ayotte and introduced the Senate counterpart. So we then went to Washington and met with the majority of our delegation and Nancy Pelosi's office, which was cool because that was her constituent member, and some other people. So we had this incredibly awesome experience, 2 days in DC, where she really got to learn how to inform policy. So that's why we covered a lot of ground here. So Ann Arbor, Lansing, and DC. So her true passion is this sort of individual experience, clinical experience, and she does plan to pursue a PhD in clinical psych. So we met with Holly Ryder-Milkovich, who is the director of SAPAC here, and talked about some projects that Alana could work on through the Injury Center and potentially form a collaboration with the Injury Center, which I'm really delighted has actually happened, because again, the timing was perfect for Alana, because the results of the campus climate survey around sexual assault were just beginning to sort of gel, and central administration, the Fleming building, was thinking about how to release these results. I don't know, again, if you're up to speed on this, but it wasn't good what was coming out. So they really wanted a strategy to show that we know that it's not good, and we're doing some things to improve prevention efforts around that. So that's why she includes here. The first bullet is really sort of her long-term passion, and then the second bullet is sort of what she and I did a lot of work together. So the products that she was able to develop over the summer ranged from, I think there were 5 infographics that provided a summary of the campus climate survey, ways that people could support victims, many others. Rebecca can chime in here.
Yes.
How to respond, yeah, the
I'll chime
responders.
in. So the foundational work that she did this summer and building a lot of bridges with Safe Fibers Connection. She developed the foundations of these several infographics, which we're now continuing to meet with folks on campus on, and will come out and many will see all over campus. We expect probably by next year. In kind of as part of a widespread campaign across campus through the central administration to respond to the campus climate survey. And that was the foundational work that she did in putting together these initial infographics. Was just brilliant.
Yeah, so it's exciting. And this is a really high level thing. I mean, we were right down the hall from President Schlissel's office, and this is something that he made a video on. I mean, this is a very important topic to the university as an institution. And Alana, I will say, had the poise and the grace and really just the presence to be part of that in a really exceptional way. So the infographics, and then I'm going to pass this around. This is our little leave behind materials. So anyone who knows me knows I'm a big fan of the one pager. So you'll see a one pager in here. You'll see her testimony, the news coverage. This is basically what I teach people how to do. So I kind of threw this together this morning, so it may not be completely complete, but that is an example of the type of documents that you need when you go to meet with policymakers in Lansing and in Washington. So this was amazing. I mean, I will say that as someone who was a registered lobbyist for many years and now in my capacity here, the ability to tell a compelling story that brings a piece of legislation to life just cannot be overstated. I mean, these staff, and in some cases the members of Congress themselves who met Alana, when she told them the story of one of her clients who didn't want to leave her dog, ended up sleeping in the car with her luggage, couldn't leave for like a month and a half. I mean, these horrible, horrible, deeply emotional stories that, I mean, you could have heard a pin drop. And that doesn't always happen. So she was able to really, provide faces and images, visuals to these concepts that in Washington, you spend a lot of time in rooms like this, like boardrooms, halls of Congress, and you forget sometimes that these are human beings out there. And she was able to do this in just a really profound way. So here you go. So I think I've already said this. So she really got the full-blown Jen Martin thing. And then she balanced that with her clinical. And, oh, is that it? Future plans. Okay. So my hope is that as she goes along and gets her PhD, that she will use her anchor in that clinical setting to inform the broader policymaking around, either domestic violence, suicide prevention, sexual assault, whatever sort of she chooses. So even though I was initially sort of unsure about the value that I could provide to her from my perch, I think ultimately it would give her a different lens for some of these issues. So it was great.
We were never unsure. Happy bonfire. So I wasn't sure what the magic would happen here, but we knew there'd be magic, and there was magic.
There was magic. It was magic. So thank you. Does anybody have questions? Is this like anything?
What happened with the legislation?
Excellent question. So, so in Lansing, one of the other bills in the package is being redrafted. And then we expect that the package will move. There are 29 other states that have similar legislation, so Michigan, as usual, is sort of catching up. So we expect that it will move on the state level. On the federal level, I actually just checked, and we have the majority of the Michigan delegation did co-sponsor, but this is like labor-intensive work. I mean, you go, you meet with them, and you got to call them back, remind them again. So unfortunately, there haven't been any hearings on this yet, but I mean, they're having trouble getting anything done down there.
Oh, really?
So,
That's
you
good.
know, it's October 1st. We have a continuing resolution now till December 11th. But yeah, so we helped a little bit, moving it a little bit forward. But it's that experience, I think, that she'll carry with her, hopefully. Any other questions? Okay, well, thanks for the opportunity. All right.
I guess we've got a little bit more time for any questions for anybody. So I don't know if that last presentation has got on any more questions for Courtney or for Dwana. But I guess it's probably worth bringing the two of you back up front and seeing if there's any other questions that have been spurred on.
Someone's typing something, so we might have
Oh.
a question from you. But please go ahead.
I actually have a question for you about your survey. You said there was some kind of, it had to go through certain tracks before it could be distributed. Was that from this, can you talk a little bit more about that? Just was that a state regulation or?
Yeah, so what we found out, Laura can probably better describe the steps that it'll have to go through, but they want to make sure that basically that an IRB is not required for one, and that the information or the questions that we are asking are appropriate in some way. I'm not sure, Laura, can you tell her more about why we couldn't just send the survey out and the steps that have to take place before it's sent out?
Sure. It's exactly what Dwana stated. Sometimes, you make great plans to do something, and then process sort of takes longer than you anticipated, or there are steps, and a lot of it has to do with careful messaging to the public. For all the work that Dwana did, and the questions went under silent reviews between the two of us, just to make sure, or to anticipate that we weren't building bias into the questions themselves. But there's a process that we have to work through with our Office of Communications and possibly administrative services as well, to make sure that it's something that we can publicly release. Because I was ready to step it up on a SurveyMonkey tool and say, let's go. And just kind of reminded about being careful, which is always a good thing, but it just means that we didn't get as far as we had hoped. It's not stopped, it's just going to take a little longer.
Thank you.
And we'll be happy to let you know when it's available if you would like to help direct people to it.
Yeah.
Can I ask one more question about the dashboard?
Yeah.
The CDC. In another life, we were working at Altarm Institute with Flint, who were trying to create a community dashboard. And there's a lot of pain in looking for a good tool and a good sources that can help integrate data. And did you come across anything? And I know you said you maybe didn't take the dashboard project to the endpoint, but did you come across any state or community that's really doing violence, really a good job with violence dashboarding or community profiling?
I guess, I don't know exactly what you mean. The states that were entities with us, or just other dashboards that I was able to?
If you came across any in general, like Flint is trying to do similar, like look at violence in the community and show it visually.
Mm-hmm.
And there's a lot of sort of pain in a lot of the community trying to do this. And they're, even looking now for a good tool and good methods and trying to learn from other communities that are doing it really well with the violence dashboard. So I didn't know if you'd come across any that could sort of emulate, like this is a good way to do it. Or
Well, I guess the only software that I was looking at was that it is kind of, with that one you're taking information that's already been like found other ways to collect it and then putting it into the software that way. So in that sense, you need the data. Right. It gets to go certain ways to display it, but there's a lot of different, like Tableau. If you have the opportunity, I would definitely check it out. It is really cool. It's kind of interactive. You can look at the different things. It kind of depends on what you want in it. That you put what you want in it.
getting under
that note, thank you all very much for coming, and thank you for the questions for everyone. It sounds like an amazing mentor experience for both the men and the mentees. So I'm glad you all had an enjoyable summer. I want to remind everyone there's an evaluation and a sheet. So if you could please remember to do that. Check out the website if you have any questions or thoughts or interest in the Injury Centre. And I think that's all. Thank you. Oh, Sarah, one last question. Did you say?
I had just one more note, so for those interns who participated, also thank you also to the mentors one more time and for all of our mentors across the center. But also that we're able to offer this internship opportunity again in future years, so please do tell your student colleagues that this opportunity is available. I think it's been a really good experience this summer and summers past. So to pass that along, also to remind people to spread the word, there is a certificate of injury available now for school public health, and we continue to spread the word about that. And if you are interested, they should talk to Sarah over there. And then finally, in our handout material today, just to pass along to more of students who may be here, we do have some part-time student opportunities that have both educational and also some pay involved in them around some injury center projects. And so for people who are interested in that, they should come look at the posting. So thanks again.
We also have a flyer on our opioid summit here.
Teresa Armstead. Remember Teresa Armstead?
Very clever.
John Rose. Remember?